Hello and welcome once again to Minds That Matter. My name is James Thomas. I'm your host. And today we have Dr. John Stoukides, who is the medical director for the Mood and Memory Research Institute of Rhode Island. And you also are involved in another venture too, with Roger Williams.
Yeah, I'm Director of Geriatrics and Palliative Medicine at Roger Williams.
Okay, great. And what we're here to talk about today is Alzheimer's, which is one of those mental health issues that I think can strike to many people's homes, not only in Rhode Island but around the country as well as in the world, as an organic mental health disorder, correct?
Correct, yeah.
Okay. Now, you've been working on Alzheimer's research for how long?
About 20 years now.
Okay, wow. All right. Now, you're from Rhode Island?
Yeah, originally born and raised in Pawtucket.
Okay. Well, that's going to give you a lot of credence to the viewers because they want to hear...
Once a Rhode Islander, always a Rhode Islander.
There you go, there you go. Now, the work that you're doing now at the foundation is you had mentioned before we went on air about some research that you're doing, and you've developed a vaccine.
Well, we haven't developed it, but we've been testing a vaccine. There's a lot of research going on. You know, and the Alzheimer's was first described a little over 100 years ago. But really in the first 95 years of knowing about Alzheimer's, we never really knew what caused it. Now there's been a fairly intense investigation into the causes of it over the last 10 years. And what we think we found now is the toxin that the body produces, a substance called beta amyloid protein, is what we think causes the people to get the disease, and a number of different reasons why you'll pick up all this and develop this beta amyloid protein in your brain. We all make it from birth to death, just some people build up more of it. And what we've started doing over the last 5 or 10 years is really working at different ways to get that amyloid out of the body. And the vaccine trial that we're doing is one of the ways of actually stopping it from accumulating in people.
So it's not a necessary protein for the function of the body?
No, your body makes these, your brain makes these big long pieces of protein in the brain that it uses for different building blocks to make different enzymes and different things that the brain needs. And the very last little piece that holds that enzyme to the wall is this beta amyloid protein. And once it gets cut off, which it does during normal brain metabolism, it should just float through the fluid in the brain and get absorbed by the blood circulation and be digested and be taken away. But people who get Alzheimer's either make a piece of that protein that's a little bit too long so it doesn't get out from the normal channels, or they make too much of it. And you know, Down syndrome patients were actually the ones that we really first started understanding what happens, because the chromosome 21 that Down's patients have 3 copies of makes this amyloid precursor protein, this big long piece of protein. So because they have 3 copies, they make more of this amyloid protein, and Down's patients invariably will get Alzheimer's in their 40s and 50s. Almost 100% of, well, actually, it's generally thought that 100% of Down's patients will develop Alzheimer's if they live long enough.
And folks with Down syndrome don't tend to live past the 40s and 50s, do they? Or?
Some make it into their 60s.
Really? Okay.
I had one patient of mine who didn't get Alzheimer's till he was about 62, which was really, really unusual. Very high functioning, great guy.
Very healthy.
Very healthy. But once he got it, it was a fairly rapid decline for him, unfortunately. He passed away a couple of years ago. But some do live up to 70-ish. It's unusual to get much past that.
Now, Alzheimer's is within a group of what we call dementias.
Correct.
Correct. Now, dementia is not such a kind word when I think when people think about, well, he or she has dementia. You had mentioned prior to the show that, what, 65% of folks with a diagnosis of a dementia have Alzheimer's.
Correct, yeah. Okay. It's the leading cause of dementia, and what I always find a little discouraging is many docs will give the diagnosis of dementia and leave it at that. And like I told you before, it's to be like saying you have a diagnosis of cancer but not telling you what kind of cancer.
Right.
When you get labeled with a dementia, you should then ask the doctor, well, what kind of dementia do you have? 65% of them are Alzheimer's. 5% are vascular dementia. 10% are Alzheimer's with some vascular features. And then there's another 10% of what's called Lewy body dementia, which is a variant of Alzheimer's. And then there's a number of different other types of dementias, from Korsakoff's dementia and Pick's disease and normal pressure hydrocephalus, and a number of other lesser known variants that can make up about another 10% of the cases. But the vast majority of people who have dementia have Alzheimer's. And I have patients come into the office and their daughter will say, well, the doc before said Dad just has a little bit of dementia. I said, well, you know, it's like saying he had a little bit of cancer. They didn't tell you anything more and you didn't ask for anything more, and people will say, no, that's basically all they told me, which I don't think is good practice in general.
There's a college basketball coach, women's basketball coach, who'd just been diagnosed with early onset dementia. Which in theory probably is going to be Alzheimer's?
More than likely, yeah.
Okay.
The vast majority of things are Alzheimer's.
Now, early onset dementia, the symptomatology that they're looking for, is it memory-related primarily? Or?
The most common feature you see early is in short-term memory, not remembering what happened 20 years ago. We remember that very well. It's what happened 5 minutes ago. The initial part of memory in your brain holds information for 5 or 10 minutes in this kind of electrical volley that goes on in your brain. And if your brain sorts through it and thinks after it holds it that long it's worth storing forever, it'll do that, or it'll say it's useless information and throw it away. The problem with Alzheimer's is you can't hold it for that 5 or 10 minutes to make that decision to store it for a long time.
So it doesn't discern whether it's useless or not, it just goes.
If it has more impact, it'll have more of a chance of surviving, but by and large, most people with Alzheimer's can't discern it. So yeah, they can remember their second grade teacher's name. They can't remember what they had for lunch, or if they just asked, when are you coming to pick me up? And then they'll call you back 5 minutes later, even though you just told them, and they'll say, when are you coming to pick me up? And it won't stay there long enough to go into long-term memory.
But they remembered the phone number. So that could have they could have known that phone number for 20 years.
It's long-term memory, the phone number, but they'll keep calling their family members, asking questions, keep repetitively asking questions. And it's very difficult for family members, and the incidence of depression and actually most medical illness is very high in family members, because it's such a stressful thing to care for these people with memory loss, because you think, well, if I just tell them one more time, they'll remember, but they can't. It's a structural defect in their brain that they cannot remember.
So it's not a choice.
It's not a choice, and people think it's volitional, but it's not. It's just that memory decays, and it decays so quickly that they can't keep it for more than a few minutes. And people will sit there, they'll educate somebody, trying to win an argument with them, and think they're all set, and then 3 minutes later, that same argument starts all over again. So it gets really frustrating for a lot of people, and the caregivers really take the brunt of it, unfortunately.
You had mentioned that it can happen anywhere from the 20s and 30s up into the 60s and 70s in terms of onset?
Yeah, onset.
Depending on what's going on in the person's brain.
Correct. Now, onset, very early onset, and a familial Alzheimer's disease, which is a hereditary disorder, genetically linked, and it's very rare, by the way, tends to occur anywhere from age 20 to 40 in families that have this gene in the family that codes for a deficient enzyme that makes that piece of protein.
Okay.
So that's one type that occurs early. There's Down syndrome-related Alzheimer's that also occurs early, typically in the 30s, 40s, and 50s in Down's patients. And then there's what's called sporadic Alzheimer's, which is the vast majority, 95%, probably more than that, probably 98% of the cases are sporadic Alzheimer's that can occur anywhere from age 50 to age 90. And tends to increase in frequency as you get older, to the point of about half the people now over the age of 85 have Alzheimer's disease. It becomes so common.
Oh, okay. And then is that genetically
there are multiple genes that can predispose you to getting Alzheimer's. None of them in sporadic Alzheimer's actually cause the disease, but a combination of certain high-risk genes and accelerated genes can actually put somebody at a little bit more risk, even though, you know, one parent has one type of gene, one parent has another type of gene. Neither of them have Alzheimer's, but when you mix the soup together, that comes out to make a person. Yeah. That person unfortunately ends up getting it. And then the other side, you can also have two parents that both have Alzheimer's, and you could be lucky enough that when they passed on their genes that you didn't get any of those higher risk genes, and you don't get it. So it's not really it's genetically linked, but not genetically caused, if you will.
Now, you'd mentioned vascular dementia.
Yeah.
Now, could that be determined by a stroke or a heart attack?
Yeah, vascular dementia tends to occur in people that have had multiple strokes in cognitively sensitive areas of the brain. Mm-hmm. It doesn't necessarily mean that you have a stroke, and that's why you have the memory loss. And we see it all too often that people come into either the hospital or in for evaluation, and they say, well, the doctor told us they have vascular dementia, and they have one tiny little stroke in an area of the brain that has nothing to do with their memory. Mm-hmm. The stroke has to occur in an area that works memory for it to cause memory loss, and your brain has a lot of other things it does. And I think a lot of times it's a more socially acceptable diagnosis, maybe, mm-hmm. to say that they have vascular dementia or dementia from mini strokes. And instead of Alzheimer's. The other thing that used to happen a lot was we would get CAT scans on people, and we see all these little spots in their brain. Mm-hmm. And we said, oh, those are probably little mini strokes. And it turns out that they're probably not little mini strokes. They're just age-related changes of the brain that look like little spots that could have been strokes. Okay. And the CAT scan reading will come back, some periventricular white matter ischemic changes. They have all kinds of different ways of wording it, but that's not what caused the dementia. That's actually just an artifact, probably, more than anything. But
the vascular dementia doesn't necessarily preclude that you'll have Alzheimer's.
No, you can have a mixed. You can have, because you think about it, half the people over 85 have Alzheimer's, and a good percentage of those, probably 5 or 10%, have stroke. Right. But they're two separate things, but it's kind of kicking a weak brain to begin with. You take the stroke, and sometimes what will happen is they'll be going along with a very mild case of Alzheimer's. It's slowly progressing, and then they have a stroke, and because of the stress on the brain and the stress on the person from the stroke, then it'll seem like that really accelerated the rate of decline of their memory loss, and didn't cause it. It just kind of made everything a little bit more noticeable.
Exacerbated it?
Yeah, put a stress on the person and made it worse.
Research is happening around a potential, I hate to even use the word, but cure for Alzheimer's? I mean, is the vaccine
that is our goal.
Okay.
Our goal really is to make this a disease of the past. Mm-hmm. We've come far enough along that we think, with research on the bench side of looking at the nature of the disease to try to figure out ways of stopping it from progressing. And basically where research is now kind of started about 10 years ago when we tried vaccinating people with the toxin that we think causes Alzheimer's. And at that time, we gave a vaccine to people with Alzheimer's, with active disease, because that's all we could know that people had active disease. And what unfortunately happened was that vaccine caused their immune system to attack the plaque in their brain and the amyloid in their brain. And unfortunately, most of them got brain swelling, and a number of them died from it because their body just got carried away attacking it. And now we've taken two main areas of research from the lessons we learned from the very small scale study. One was that they looked at the people who died brains and found that the plaques were actually being removed because of that. And then they identified the antibody that the body makes. Mm-hmm. And what we've been doing for a number of years now, and better drugs are coming down the pipeline that we're working with, are making that antibody in a lab and giving that to people so we can control the amount of plaque that we take out and amyloid that we take out of their body. Mm-hmm. And we'll do an MRI scan every 3 months to look for subtle changes that we're taking it out too fast. We'll back off, we'll cut down the dose. We can really work it because we're giving you the antibody as opposed to turning a switch on your immune system and letting it attack it all. So we're doing a number of trials now with that for people with mild to moderate Alzheimer's, trying to slow down the rate of progression of the disease. The other thing we're doing is there's been a new technology that's come out in the past year or two that we've been using in research, which is a type of scan that actually will, a type of PET scanning that will look for plaques in the brain.
Okay.
Not commercially available, but a research tool that will actually tell us that somebody who has some mild memory loss may be at risk of getting Alzheimer's in the near future.
Okay.
Much higher risk than someone who doesn't have that. And what we find is when we do these scans on people, about 7 out of 10 don't have the plaque in their brain and have memory loss for other reasons, but a few of them do have that high burden of plaque that's starting to develop but haven't really developed full-blown symptoms yet. So they don't have a lot of plaque. We give them a vaccine that is designed to kind of slowly rev up their immune system rather than turn it on all at once. So you're slowly revving it up. You're watching it by MRI scans to see if you're revving it up too fast. And then you're also giving it to people with a lot less plaque in their brain. So that's what we really hope, you know, looking down into the future. The goal would be find people at risk, family history, early memory changes, do a scan, find out that they truly are at risk, and then give them a treatment to stop them from getting the disease and make it a thing of the past, except for those that fall through the cracks.
Right.
And
You've done a vaccine with somebody.
Yeah. We have currently in a trial now. I believe we have 6 people enrolled in it. We were actually the first site in the country to administer this in this phase of the protocol to dose a patient who I just saw today who's actually doing relatively well. She'd probably be doing well without the vaccine because once again she's very early stage, hasn't really developed symptoms yet, but is, you know.
You said it can take years before you'll even know whether the vaccine is being effective or not.
Yeah, that's one of the biggest challenges we have with Alzheimer's research is 2 big things. One, if you're trying to slow disease progression of a slowly progressive disease, you've got to, it takes time to follow these patients over time, year, 2 years, to see if they actually decline over that time as opposed to subtle day-to-day changes that we all have. We all have a good day and a bad day. You don't want to go in on a bad day and come out on a good day 3 weeks later and say the drug works. You want to be able to say definitively over a year, you're clearly better off and have a series of points over that year. So that's part of it. The other huge challenge we have is, though there are millions of people in the United States with Alzheimer's, very, very few get involved in research trials, which is really disturbing. You know, in one of these passive vaccination trials that we're just about finished enrolling in, it's taken 3 years to get 3,000 patients nationally into this trial.
Oh my goodness!
And there's well over 1 million people who would have been eligible for it in the country.
What's going on there? What do you think some of the issues are?
A lot of denial. People don't want to admit that they have it. Family members don't want to admit they have it. There's that old, well, I don't want to be a guinea pig, let somebody else be the guinea pig. Well, I always tell people the guinea pigs are playing Scrabble, they're doing fine right now. These, you know, the phase 2 and 3 trials that we've had have really been gone through all the animal testing, the healthy volunteer testing, and they're very heavily watched from the FDA to make sure that everything is designed for patient safety. You know, most people don't realize the primary goal of a clinical trial is patient safety, not does the drug work or not.
Right.
And our first and foremost thing is making sure these people that are volunteered to be in this trial are as safe as humanly possible to get them on it. And we watch people much closer than, you know, you go to the doctor and you get a prescription for a drug. Well, that drug has potential side effects and some unknown side effects that we don't know yet, but you see the doc back in 6 months after you take it. In a research trial, we're doing you know, blood work every couple of months. We're doing MRI scans. We're really, you know, we're calling you frequently to check up on you.
Well, you're dosing the vaccine monthly, right?
Yeah, it's a series of vaccinations over a 6-month period.
And you're done.
And then we watch them for the next year and a half, do some PET scans and MRI scans every 3 months to
the kind of cognitive testing that you do during that time as part of follow-up, what are some of the things that you do?
We do a pretty extensive series of testings that both look at you know, most people will go into the doctor's office and they may do the mini mental status exam, which is a little 30-question thing that you know, we all do just for screening. The actual memory testing usually goes into about an hour or two of testing, really getting into very specific domains of how your memory works, and to document it. You know, you don't pass or fail. You get a score, and then we analyze those scores every 3 months over a course of a 2-year period to see if any of those domains are getting better, any are getting worse. And then we also do a lot with caregivers, because you know, one of my favorite lines that I always tell people with memory loss is, and their families especially, is people who really have a memory loss forget they forgot things. And if you forget that you forgot things, you don't remember how your day's been going. You just kind of fall back to what you think it's going like. Right. Whereas that caregiver, that's an essential part of the research team when we do a study, really has to be there to say, well, she doesn't really remember that this happened, or you know, she does seem a lot better. She's still forgetful, but she seems, you know, better. I can remember this one patient we had on a trial once, and his wife came in after a while, and she said, you know, the other day he was in the kitchen cooking soup, and he hasn't done that in 3 years, and it was good. You know, and then, you know, a few weeks later, he went out and fixed a lawnmower that had been broken for 2 years.
Oh my goodness!
So you know, things start coming back in some, you know, unusual to see something like that, but he really did well. He fixed an old generator on his property. Started, after a while, started driving again.
Somebody who was part of the study.
Not this particular, a previous study that we did, and
wow.
Actually in an ongoing trial that we're doing, looking at one of these passive vaccination protocols. And you know, obviously people get worse on trials too, but it was just unusual to see somebody that just did that much better over time. Now he's starting to decline a little bit again, but you know, we're talking 5 years we've been working with him now, or 6 years.
How old is he?
He's in his 80s now. But you definitely see some people, you know, it's one of those things that really gets me and my staff going when we see somebody, you know, we hope these protocols will stop the disease from getting worse, because, you know, unfortunately, and that's another thing that keeps people out of trials, is they don't think it's going to happen to them when they have early disease, and they say, oh, everything's fine now. Well, Alzheimer's is one of the few incurable terminal diseases that we have. Virtually every form of cancer we can cure people with. We don't have a cure for Alzheimer's. Everyone who gets Alzheimer's, if they're not lucky enough to die from something else, will die from Alzheimer's. And it's an ugly, miserable death at the end of the disease. And anything you can do to delay that from happening or stop that from happening is important, but people don't realize it. You know, oh, it's, you know, they lessen the fact, oh, she's just a little forgetful, don't worry about it, it's not a big deal. And then, oh, a little bit more forgetful, and then they get into that mid stage where they start getting some behavioral disturbances and agitations and hallucinations, and you know, and urinary and bowel incontinence, and you know, to a point that they can't feed themselves anymore, and the disease keeps getting worse. But
there's a term that folks use in the hospital and in other settings, nursing homes, sundowning.
Yep.
And that's a term that usually, when the person sort of dramatically changes their mental status on the onset of the evening?
Yeah, I think, you know,
is that a fallacy? Or is that...
No, I think we all sundown. That's where happy hours came from. We just found ways of treating them for ourselves. You know, somebody who's living with Alzheimer's has an incredibly stressful day. Every minute's new for them. You know, picture being put into a brand new setting every 5 minutes. By the end of the day, you're frazzled.
Yeah.
And people with Alzheimer's get frazzled. And when they get frazzled, they can't rely on their cognitive strengths to move forward and to manipulate the situation and get them through it. They fall back on a more primitive response, which can be agitation and combativeness. And it's almost an expected thing, you see. You know, they'll all get a little stressed by the end of the day.
And if they're misperceiving who's in front of them, they may see someone who either they don't know or it's someone they didn't like, or would that be, I mean, in theory, that's a hallucination? Or?
Well, it's not a hallucination. Most people with Alzheimer's don't hallucinate. What they tend to do is they remember their dreams very well.
Okay.
So they'll wake up in the morning and say, there was a man in my room that went through my drawers and stole something. Because they'll, for some reason, recall that dream, but they won't recall waking up from the dream.
Okay.
So they can't differentiate the two, so there was somebody in my room. The other thing that happens is we all have pictures in our minds of people around us. And frequently that picture in our mind is a much younger looking,
right.
I don't know if this is a reason for it, but when you look in the obit in the newspaper, you see these pictures of young
That's
people.
right.
Because that's what you remember that person looking like, and that's the picture you want everyone to remember them looking like. Well, we all have those pictures in our minds too. And frequently what you'll see is husbands confusing daughters with their wives, because their daughter looks just like their wife did 30 years ago, and that's the picture that stayed in the husband's mind, so they'll misperceive that. The other thing is people, we all have similar facial features to other people, and somebody may just look like somebody that you hated, that really did you wrong at part of your life, and that person just reminds you of it. And though, if you saw somebody, you would just say, oh, that's Joe, I know I don't, I never met him before, but he looks like Fred, and I hated Fred. Well, that all requires your short-term memory to make that series of connections and to keep it with you, so when you see Joe again, you don't get upset and think it's Fred. Well, the Alzheimer's patient can't do that.
You can't differentiate,
So that whole line of reasoning that it's not him, it just looks like him, is gone, and it's him, and I hate him, and I told him the next time I saw him, I'm going to punch him in the face. What do you do?
Right.
Go over and punch him in the face. And you don't have that fine control over your actions as much.
You had also mentioned before that there are ways to kind of delay the process, but you can't stop the process. If it's going to happen, it's going to happen. But reading, using musical instruments, the creative arts, all of those kinds of things can stimulate the brain and make it function at a higher level up until.
Yep, absolutely. I think it's the more you do for your brain, the better exercise, the better strengthened your brain is, the less impact it will have when a disease affects its function. That said, about a year and a half ago, I gave a talk at the Hope Alzheimer's Center. They wanted me to give a talk on ways to prevent Alzheimer's. And 2 days before my talk, the National Institute of Health came out with a consensus statement about ways to prevent getting Alzheimer's, and their statement was there was no way of preventing it. And it's like, so I get up in front of 100 or so people at the Hope Center and
they're all hoping.
I'm unfortunately here to tell you that up until 2 days ago, I thought there were some things we could do, but research now shows that there's nothing you can do.
Except for this vaccine, possibly.
Possibly, But as far as, in general, eating well, exercise, physical and cognitive exercise, is important to stay healthy. And we in general still think that the more you do to keep yourself cognitively intact and growing, the more you do to keep yourself physically fit, and the more you do to have good nutrition, not go overboard or underboard on anything, is good.
So play Scrabble and go out for a walk.
Exactly.
We unfortunately, I told you it was going to be quick.
It was quick.
We are already done, and I just want to thank you very much for this opportunity to have you here today.
Thank you. It's a pleasure to be here.
Oh, it's great. Thank you.